Thank you. Chairman Hennessey.
Thank you, Mr. Chairman. One of the reasons that's been put out there for considering this merger in the first place was the assumed savings of between assumed savings of $90 million that could be realized. My information, part of that $45 million we've heard would come from a reduction in the pharmacy dispensing fee that we just set last November, 4 months ago, at $13. Originally, it was proposed to reduce that $9 down to a level of $4 per dispensing fee or per dispensing activity. Now, recently, it's been changed, and people are saying, well, we'll only reduce it to $7. My information indicates that CMS requires a reasonable professional fee, and that none of the 15 states that have either settled with CMS under their new programs or have announced publicly what their fee will be has been less than $10. So I guess the question is, what can you point to justify any reliance that CMS will allow a fee essentially $3 less than any other state in the union is charging and has been approved for? Can you point us to any specifics with regard to that? The range that I'm hearing is New York is at $10, North Carolina is at $13. Why would CMS allow us to go to 7, let alone 4? Secretary Dallas, I guess you and Secretary Osborne deal with this most in PACE and PACENet and Medicaid, so why don't you...
You get on the MA side.
Chairman Hennessey, the proposal was to try to align PACE more with the dispensing fees that are in the Medicaid program. So right now for fee-for-service, we're at, I believe, $2 for a dispensing fee, and we put an initial placeholder in the budget of $4. Since that time, there's something called the outpatient drug rule that we have to comply with the federal government that you referenced, that we have to go through a process. And it's a very public process. We put the methodology out there at our most recent Medicaid Advisory Committee meeting, their comments being received, and ultimately, you're correct, it has to be approved by the federal government. Through that methodology, we've also met with pharmacists. We've started meeting with pharmacists, walking through the methodology we used, and also letting them ask questions along the way. That methodology, we think, following the law as it is now, that our actuaries came up with $7. So our placeholder was 4 initially. The actuaries said it was 7. Now that process right now, that analysis is going through a public process. Folks comment on it. We're holding meetings. Anybody can see the exact methodology and how we followed what we thought was the letter of the law with the federal government. I can't speak to how other states settled their amount, but we know, when we're looking at what the law says and how that translates to Pennsylvania, the number that our actuaries came up with was $7. In addition to that, we knew that there was a lot of interest in this number. We also asked a consultant, Public Financial Management, to do an independent review of the methodology that we used. They came to a very similar conclusion that we have, and I'm happy to provide that letter to the chair. Their estimate now, based on the data they have, is between at $7 is between $38 and $55 million in savings. We had put the initial number at $45 million. As we get more data and we work with the current vendor, we expect to narrow that range a little bit. But based on our pharmacy folks and our experts, they looked at the methodology required under federal law. They worked with our actuaries. They came up with $7. We're going through that comment process now. We had an independent consultant take a look at it. They verified the savings range that we were talking about. But ultimately, it will be something that has to be approved by the federal government. We think that we've followed what the law says. However, we're open to all comments from pharmacists, from members of the General Assembly to work through that process. And we certainly understand at the end of the day, the federal government will be the final arbiter there.
Okay.
Thank you, Mr. Chairman. And while Secretary Dallas certainly has the expertise with regard to the fee-for-service on the Medicaid side of the pharmacy program benefit for Pennsylvanians and Medicaid, as you know so well, the PACE program is an awesome pharmaceutical benefit program for individuals age 65 and older in the Commonwealth of Pennsylvania. our PACE program is set by statute, whereas the federal program is set by CMS statute. So while there is an awesome opportunity that we have in a consolidated model to get the best benefit for all Pennsylvanians in need of assistance with pharmaceutical prescriptions, we can build off that PACE platform. That's the effort and the goal with regard to consolidation. To be certain, increasing the dispensing fee to $13 last year was giving us an opportunity to also respond to the pharmacists that were raising questions and also be conscientious of the customer at the counter when they go to get their prescriptions at their local pharmacy. That $13, certainly we want to leverage that in terms of best providing a benefit for pharmaceutical drugs in Pennsylvania, but we also are sensitive to the fact of the solvency of the lottery funds. So while we would love to have an opportunity to have more folks in the PACE and PACEnet program, we need to be sensitive to how much money we have available from the blessing of a lottery program in order to provide those services. So we're being sensitive to the needs of the customers while also being conscientious of the limited resources that we have entrusted to our care, both from a lottery fund as well as federal funds and state funds that best support the Medicaid program. But we do see great benefit as we move forward in a consolidated model to get the best of the benefit of the PACE platform from a purchasing power and also best lining up our regulations and our policies and procedures to ensure that Pennsylvanians in need of this assistance have access to it. We're also sensitive to the fact that we in Pennsylvania have no control over rising drug prices, and that's something that I trust that you and we will work together on in terms of what we as a country are facing with astronomical pharmacy prices in some instances to ensure that we have better control over those costs so we can in Pennsylvania ensure that Pennsylvanians have access to these great benefits.
Okay, thank you for your answers. The one thought that occurs to me is that a savings of $38 million that seems to pale by comparison to the size of the agency that we're considering creating here. I've heard in testimony at prior hearings and meetings that this new agency would be a $40 billion agency. Yesterday we were considering the state budget at around $32 billion. It seems to me that a $40 billion agency probably puts this new agency on a comparative rate, I think, with a budget that is exceeded only by perhaps 5 or 6 states in the United States of America, California, New York, Texas, and a few others. $40 million worth of savings doesn't seem to be worth the kind of effort and all the disruption that would take place in order to save that small amount of money. Can you comment on that, Secretary Dallas?
Sure. I guess the first thing I would say is it's a funny job that we have to ever say that between $38 and $55 million is a small amount of money. I think to a lot of people in Pennsylvania, it's not a small amount of money, especially when it's coming out of taxpayers' pockets. From my perspective, I don't think $38 million or $55 million or $45 million is a small amount of money. It is true that—
I'll agree with you on that. I don't have that kind of money in my bank account either. But consider it relative to a $40 billion budget.
So I think that when you look at the budget challenges the state faces, those kinds of savings are things that are needed. When you look at the solvency of the lottery fund and being able to return money to the lottery fund and getting to a positive balance, those savings are critical. And while it may be as a percentage of the overall state budget a relatively small amount, it is a big deal for the solvency of the lottery fund. It's a big deal for savings to being able to continue to provide services. And it's a big deal in terms of getting a pharmacy program that gives the best value to the taxpayers.
Okay. Thank you, Mr. Chairman.